Welcome back. We are answering your questions about the coronavirus with Cone Health Chief of Health Equity and Chief Medical Officer, Dr. Alvin Powell. Remember, you can text your questions to the number that's right there at the bottom of your screen. All right, we get this question a lot. Do you need to wear a mask even after you get the vaccine, and why?
That's a great question, and I can appreciate the person asking that question. Absolutely, you need to wear your mask. You need to wear your mask because we're in the middle of a pandemic, number one. And the fact of the matter is that the vaccine is 95% effective. It's not 100% effective, so you could still get infected. Number two, if you get infected, there's a possibility that you might not get really sick and that you have an actual infection with no symptoms, and then you can transmit it to someone else. And so, number one, you don't want to get sick. Number two, you don't want to give it to someone else. And so it's extremely important to continue to wear the mask, wash your hands, and be socially distant. So don't stop wearing the mask once you get the second vaccine. Let's wait until this pandemic is over when we get the green light to do that.
All right, let's follow up on that question because this person is asking, is the vaccine used to prevent disease, but does it also prevent infection? And it kind of sounds like they're the same thing, but they're not the same thing.
Right. So let's talk about that, disease versus infection. So I think what this person is probably suggesting is that the disease is someone getting very clinically ill. So you're very sick with fevers and chills and flu-like symptoms, or you can't breathe. That is a disease process. And then the second thing the person referred to as infection, you could get infected with very little symptoms since you've had the vaccine. Your body is mounting an immune response to an infection that you have that's very, very mild. But you do in fact have the infection and you can transmit it to someone else. So the disease state, you're very, very sick, asymptomatic infection or asymptomatic carrier, you've had the vaccine, you mount some antibody response, you mount an antibody response to that, but you're not really sick, but you do have the infection in your body and you can give it to somebody else. We don't want that to happen. You don't want that to happen. And so we continue to remain safe and practice the 3 W's.
Okay, and so is that pertaining to just COVID, or is that pertaining to anything that you get a vaccine?
Well, let's talk about COVID because we can talk about measles, mumps, rubella, and those kinds of things, and that's gets into a different discussion. So let's talk about COVID and let's continue to be safe with COVID and stick with the 3 W's.
Okay, and this person is asking, can you touch on the effectiveness rate? Both vaccines are 95% effective. They're talking about Pfizer and Moderna. What are the successes of having such a high effective rate?
Well, I think that at a 94, 95% effectiveness, there's a greater chance of us mitigating this pandemic more rapidly than something that's less successful. So it's really fantastic. We've got great vaccines with great success rates and a great safety profile so far. And it is extremely important that it's at 94 and 95%. Because it means that we can get to our goals of herd immunity much more rapidly.
All right, this person says, what will happen if you get the second dose 3 days early or in 18 days instead of 21 days? How much does the timing actually matter?
What we know is that the efficacy of the vaccine is based upon the clinical trials. And so you want to try to be as close to the recommendations from the manufacturer as you can. 3 days early, if that's within the window of the recommendations, it's safe. But when we get outside the windows of the recommendation, we really can't know what to expect from the vaccine. My recommendation would be to try to be consistent and stay within the manufacturer's recommendations based upon the clinical trials as much as possible.
This person is asking, if I just got another vaccine like the flu or the shingles vaccine, when is it safe for me to get the COVID vaccine?
If the person just had the flu vaccine, can they get the COVID vaccine? You can get the COVID vaccine around the same time.
And shingles the same, or?
I am not sure about shingles. That will be something you need to discuss with your physician. I can't answer that question right now.
Okay. This person is asking, I had COVID in September. Is it safe for me to receive the vaccine now, or do I need to wait since I may have antibodies still existing?
No, it's fine for that person to get the vaccine now, this far out. No problem.
From September to now, to February.
Yes,
okay, this person says, are annual vaccines for COVID going to be needed like the flu shot?
There's a very good possibility that that is correct. We'll find out. But right now we know that mutations are taking place, and so there is a possibility that we might need to take this vaccine on an annual basis. That's correct.
And this person is asking, do we have a timeline for when the vaccine may be administered in a regular doctor's office?
That's a great question, and a lot of that has to do with the supply chain. So I don't think anyone has an answer to that question right now. We're still trying to get mass vaccinations done, so there's no clear answer to that question right now.
Okay, and we're still working on it. We're still very much in the kind of infancy stages of how we're getting this all done. All right, we're going to continue to take your questions. You can text those questions. The number's at the bottom of the screen, 336-379-5775, and we'll be right back.